Hi, my name is Dr. Odoyo Edward. I'm a dental surgeon at Kisumu Dental Centre, and today we are partnering with Ponea Health to speak about tooth extraction. Additionally, you should maintain good oral hygiene by brushing your teeth at least twice a day, in the morning after your breakfast and at night before going to bed, so that the area where the tooth has been removed from remains clean and to avoid infection. You will also need to take your medication as prescribed by your dentist following tooth extraction. There are certain things to avoid after the tooth extraction. For example, avoid spitting saliva from the mouth, as this will disturb the clot that initiates the healing in the extraction area. Avoid touching the area with your fingers or your tongue. Avoid drinking using a straw, and avoid chewing on the same side where the tooth has been removed from for at least 2 days. Now, if your loved one has had a tooth extraction, you may want to support them. For example, if the extraction has been done under sedation, it means they may be a bit drowsy, so you need to accompany them so that you are able to get them back home safely after the tooth extraction. But in most cases, if it is done under local anesthetic, and one would be able to find their way back home on their own. Now, there are some limitations that are brought about by removal of a tooth or tooth extraction. Some of them are temporary. For example, immediately after the extraction, you may not be able to chew on the same side where the tooth has been removed from, and so that will reduce your ability to chew during the healing period. It's possible to resume normal chewing by at least the third day after the tooth extraction. Now, on the long term, permanent loss of a tooth removal is an irreversible procedure. So once it is removed, it creates some sort of disability on your jaws by reducing your ability to chew. And this is particularly true if you have several teeth removed, especially from the same side of the jaws. So under such circumstances, you may need to have some artificial teeth put in place to replace your teeth which have been removed to restore the function, which is chewing. Now, there's a myth that is widely circulated that the only remedy for a painful tooth is to remove the tooth. Now, this is not true. Tooth removal, although is one of the remedies for a painful tooth, there are lots of other interventions that can be done by your dentist to preserve your tooth. For example, filling the tooth, having root canal treatment, and more besides. Thank you for viewing this episode, and we invite you to join us again and check out our next episode. You can access our services by booking on poneahealth.com.